Hello, I'm here with Dr. Melhem Solh, an expert in diffuse large B-cell lymphoma, or DLBCL. In this video, we'll discuss Zynlonta dosing and administration. Dr. Solh, let's start with the basic question. How is Zynlonta given to patients?
Zynlonta offers patients a simple dose and schedule. It's given as a single 30-minute IV infusion. It's given every 3 weeks. The Zynlonta infusion may be given in the inpatient or outpatient setting. Administration at a specialized center is not required.
Is the fact that it's a single agent important?
In my experience, it is an important consideration for patients in their third line of therapy. Remember, they've already endured 2 prior treatments, which are typically multi-agent regimens, and everything associated with them. In some cases, patients have received more than 2 prior treatments, as was the case for many patients in LOTUS-2, the Zynlonta pivotal trial. So being able to give patients a single agent treatment every 3 weeks in a 30-minute infusion is definitely a plus.
I understand completely. Now, prescribers watching this video would likely want to know the recommended dose of Zynlonta.
So the recommended dose is Zynlonta is 0.15 milligrams per kilogram for the first 2 cycles, and then we dose reduce to 0.075 milligram per kilogram for subsequent cycles. In LOTUS-2, Zynlonta was administered until progressive disease or unacceptable toxicity. It's very important to note that pre-medication with dexamethasone is recommended to help reduce the incidence and severity of adverse reactions related to the PBD dimer, the cytotoxic payload for Zynlonta. The recommended dose for dexamethasone is 4 milligrams. You can give it oral or IV twice daily for 3 days, beginning the day before Zynlonta infusion, unless there is a contraindication to give it.
Dr. Solh, if a patient has an adverse reaction during Zynlonta treatment, should the dose be modified?
The Zynlonta full prescribing information provides recommendations for dose delays, modifications to address any adverse reactions based on its severity. As shown in this table, dosage delays are recommended as the initial measure to allow toxicities of a particular grade to resolve. If a dosing is delayed by more than 3 weeks due to a toxicity related to Zynlonta, the subsequent dose should be reduced by 50%. Now, at that point, if the toxicity recurs following dose reduction, discontinuation should be considered. And please note, if toxicity requires dose reduction following the second dose of 0.15 milligrams per kilogram, which is cycle 2, dose 1, the patient should receive the dose of 0.075 milligram per kilogram for cycle 3.
I suppose my last question about dosing is this. Based on the types of patients receiving Zynlonta and common dosing and administration-related challenges for patients with relapsed or refractory DLBCL, how often would the Zynlonta dosing schedule be a major factor in treatment decisions?
So in my opinion, and speaking from my own experience as a physician, I would consider the Zynlonta dosing schedule a very meaningful and beneficial feature in this category, and in particular for this patient population. For that reason, it would almost always factor into treatment decisions for such patient population.
Dr. Solh, thanks so much for sharing your time and expertise. We hope you found this discussion informative. To see more of our discussion, please watch the other videos available in this series. For additional information, you can visit ZynlontaHCP.com or contact your ADC Therapeutic Sales representative. Now, please take a moment to view the important safety information for Zynlonta.